morning and welcome to Sharing Vaccine.
Okay, guys, everyone is coming in. I'm going to go on ahead and get started. My name is Annie Crook. I'm the Midlands Regional Coordinator here at ST Thrive. And like Eva just said, today we're going to be going over sharing vaccine facts and the steps you can take to help those that may be unvaccinated go through those steps and understand the process of what we need to do in South Carolina to combat the coronavirus pandemic. So first, we're going to be going over a little bit of the most recent numbers reported by DHEC, the Department of Health and Environmental Control. So these numbers were reported yesterday, February 24th at 11:05 a.m. And this data is actually from 2 days before on Tuesday, February 22nd. So because of those dates in South Carolina, we've had 542 new confirmed cases, 463 probable cases, 26 confirmed deaths, 4 probable deaths, and then there's been a little over 9,000 test results conducted in that time frame. And with that, the percent positive of those tests that were done was 9%. So as you can see, our numbers have been slightly decreasing, but obviously we've been in this pandemic for over 2 years now, so we need to do our best to make sure that we're getting people vaccinated so that way we can combat this coronavirus pandemic and keep on moving on with our lives. So with that being said, you can take a look at this map right here and see the percent of residents in South Carolina that have a completed vaccination status. And so by completed vaccination status, that means that they've received both of their vaccine shots, whether it was the Pfizer or Moderna vaccination. And this is just showing that percentage based on counties. So as you can see, the bluer the county is, the more percentage of residents are vaccinated within that county. And then the closer it gets to orange into red is the lowest vaccination efforts. And this data was reported on February 20th, 2022. So with that being said, there are a lot of counties you can see, especially in the upstate and up in the PD area as well, that we really need to work on getting vaccinated, get that completed vaccination status. And one way that we need to work on doing that is making sure that we are listening non-judgmentally. So people always have a variety of different reasons for not being vaccinated or being reluctant to getting the COVID-19 vaccine. And you cannot begin to persuade someone unless you know and understand what reasons they may be facing and why it might be a difficult decision for them to get vaccinated. So with that being said, you have to set judgment aside, and it is critical to be a good listener. You need to be able to ask yourself without judgment, why aren't you vaccinated? Non-judgmental listening is about trying to really understand the other person. It is about going above and beyond just hearing the words spoken and involves understanding exactly what the other person is communicating. Listening non-judgmentally helps a person to feel heard, understood, and acknowledged. Most importantly, non-judgmental listening builds relationships, it facilitates communication, serves the purpose of earning trust of others, and it helps you understand their situation. Active listening comprises both a desire to comprehend as well as to offer support and empathy to the speaker. Finally, it validates the speaker and makes them want to speak longer. And it can set the tone for this and future interactions you have with them and either other people in your own life. The first thing you need to do is to create a safe environment for a conversation to take place, which may mean finding a quiet place to go and have this conversation, like you can see in this picture, or it can mean turning away all electronic distractions such as turning the ringer off of your phone, putting your phone on silent, or making sure you're not constantly looking at social media distractions. It could also include being in a place where there's not a lot of noise or interruptions. This will make a person feel comfortable enough to speak openly without fear of judgment, and the speaker will be able to talk honestly in a trusting environment. And with that, there are 3 conditions that help to create this safe space: acceptance, genuineness, and empathy. Before reaching out to an individual to provide non-judgmental listening, it is important to evaluate your own frame of mind. You need to ask yourself, am I prepared to express concern without judgment? Am I the best person to help this person? And can I invest the appropriate amount of time in a conversation right now? Those three questions are very important for us to have in our day-to-day life, but especially in the case if we're speaking with someone who may be facing an issue revolving getting the COVID-19 vaccine. Even though the other person's views may be different than your own, it is essential that we respect and accept them. We should be understanding of others' experiences regardless of our own. Empathy is by far one of the most important characteristics of a good leader. Being able to see things from another perspective, whether it is in your professional or personal life, it will give you a great insight into their own lives and their daily choices and tasks, which will allow you to better understand who they are and what they do. So with that being said, it's also important to understand the reasonings why someone may be hesitant to get the COVID-19 vaccine. In becoming empathetic and developing a plan to reach the unvaccinated, it is important to set aside attribution bias or making assumptions about someone's reaction or someone's reason, and being understanding as to their reasoning why, and becoming empathetic. Reasons for the remaining unvaccinated fall into three main groups and a fourth miscellaneous mix of things unique to the individual that we may or may not have ever considered. The first group, the apathetic group, includes those who may view shots as an inconvenience or maybe view it as unnecessary given their circumstances. For individuals that fall underneath their group, they may just find the vaccine not a priority in their life, or they don't see the need because they see themselves as personally having low risk if they got the illness or its complications. For those who fall into the vaccine hesitant or skeptical group, those include people who are not completely opposed to the vaccine in general, but are unsure of the medical science behind the vaccine or are wary of its safety and possible side effects. For those who fall into the political reasons group, they often surround themselves with like-minded people in their own community and social networks where their beliefs are continuously reinforced. This can make changing course difficult because it feels like it would be changing a part of their identity, which we'll be going into a little bit of detail later. And last but not least, some might fall into the fourth group, the miscellaneous personal reasons group. And this may mean that you will never know what their exact reasoning may be unless you ask. It could be because they may have some confusion about vaccination eligibility, the cost, if there's insurance coverage for the vaccine, immigration status, knowing where to go to get the vaccine, things like that. But it also can be practical reasons, such as having lack of childcare in order to go get vaccinated, not having the transportation needs, or even having to take time off of work. Or it could just be simple fears, such as having a fear of needles, or having a reaction, or having to miss more work and not being able to get home after you got vaccinated. Listen to them and hear where they are. There could be a reason there that surprises you and a way that you can help yourself. The important thing is to not make assumptions about what the barrier is. After we listen non-judgmentally and learn what an individual's reasons and barriers are, we must meet people where they are and not where we want them to be. It is important to tailor our messages and adjust our approach to the different types of barriers and focus on our relationships with the unvaccinated. For the vaccine apathetic group, incentives work well. These can be public incentives like a free concert or sporting event, or giving someone the ability to travel, free food, giveaways, or opportunities to win a grand prize. Or it can be personal incentives like, hey, I can wash your kids this weekend, or can I mow your lawn, or can I cook you dinner, wash your car, things like that. Finding the answer with the specific individual to what can I do to make this worthwhile for you is key for this group. For those who fall into the hesitant or vaccine skeptical group, it's important to explain that the technology that's enabled us to develop a vaccine so quickly has been in place and have been in development for many, many years. So the safety of the vaccine is in no way compromised. Education distributed to debunk myths should be distributed as widely as possible. It is important to make individuals aware of the recent FDA stamp of approval for vaccines. For those who fall into the political objections category with whom the decision is not to get the vaccine because it's tied to their identity, they may need to have, of course, a cover story to safely change their mind and to save face. A good approach is to point them to someone who has similar interests as them, but may have argued in favor of vaccinations or themselves have gotten vaccinated. Having someone you really respect of the same political, religious persuasion, and having them say that they got vaccinated and it's a good thing, will make that narrative fit their identity. For those who fall into the miscellaneous category group, it is important to share some of the more practical concerns, like getting employees to offer paid time off to get vaccinated, or for large employers to bring vaccine clinics on site to their own office, offering transportation and childcare needs, and then having awareness and education campaigns as well. As you can see here, trust is also important. It's very important to determine which sources of information people trust. To address hesitancy, people have to hear from their local, personal, and reliable stories about vaccinations from the people that they know and trust, about how it benefits not only themselves, but how it is also benefiting others in their own community. Determine who or what has earned their trust when you're speaking with these individuals, and try to enlist some of those sources in your campaign. Strategy should acknowledge existing distrust of the medical system, pharmaceutical companies, and even the government, particularly among historically marginalized communities. Data on safety and efficacy is easy to come by, but listing out facts and figures alone is likely to be a losing strategy. Sharing an article from a media or news source is unlikely to have an effect if that individual distrusts the media. So with that, there are many pieces to the puzzle in encouraging the yet unvaccinated to change their minds. Understanding that the unvaccinated is not a singular group of people, and that the reasons for vaccine hesitancy are universal and key, and are not universal and key, is key in developing a plan to reach the unvaccinated. Appreciating those realities and translating them into action can support our ongoing fight against COVID-19. Successful communities embrace a multifaceted approach. It takes a variety of puzzle pieces to complete the picture of success. Community leaders should use a set policies and incentives to promote safe behaviors. Fighting miscommunication remains critical, but as does interconnecting the principles that underpin public health. These include having one-on-one conversations, providing talking points and tips and conversation starters to the unvaccinated, as each one reach one approach. These also include having public awareness and education campaigns about the availability, the efficacy, the safety, the long-term complications or chronic problems which develop even for people without a severe infection. Letting people aware of what's to come is very important to help these people feel encouraged to get this COVID-19 vaccine. It's also important for employees to encourage to adopt vaccination policies to reflect their values in their own workplace. Increasing availability to barriers like transportation and providing childcare or elder care. Encouraging businesses to participate in incentive programs for those who may be apathetic. And then bring diverse leaders from a variety of groups together to talk about why it is important to get vaccinated, and providing a link to different individuals' identity groups. And then lastly, having town halls in church groups and schools and different community organizations to discuss the benefits of being vaccinated and allowing them to share their own stories. So with that, it is very important to create a safe place for the person that you are speaking with, so that way they feel that their concerns have been heard and understood and acknowledged. This is the most important beginning first step. Make sure that you are being invitational, that you are listening, and you are being friendly and opening to different viewpoints, that you are establishing trust with this individual, that you are being patient, and that you are setting modest expectations. Keeping the expectations modest and setting the achievable goals is very important when you're speaking to this individual. Changing mindsets takes time and repetition, so it's important to not be discouraged if it doesn't happen right away. It's also very important that you share personal stories and beliefs. Each person who shares a vaccination story and the benefits of being vaccinated serves as a positive example and a good steward of public health. We know that when people feel heard, they're more likely to be open to listening. So we start from a place of listening, and then we hope that it happens in both directions. Listening to people with a sense of humility, being curious about what their reasons are and what their concerns are, or more likely to put them in a position where they themselves are open to gaining new information. You are in a much better place to talk about how you feel and why you do the things you do, and then ask them about their own perspective. With a variety of different approaches focusing on trusted people, groups, and institutions in local communities, we can begin to move our communities to a place where more people feel safe and comfortable about choosing the vaccine to build thriving communities across our state. And with that, at SC Thrive, if you are interested in finding vaccine resources, vaccine locations in your county, and transportation needs in South Carolina, please check out our website at scthrive.org/find-your-vaccine. Additionally, it's also very important to note all of the other resources and information that are available at your fingertips. Some of these include the SC DHEC statistics about vaccination numbers, the DHEC vaccination locator. So if you want to find a specific locator within your county or your city that you reside in, the DHEC vaccination outreach materials that show all the different signs and symptoms you need to be into contact with if you think you contracted the COVID-19 virus, and then everything you need to know about the vaccine. You can find that there on their website. You also can go to our SC Thrive website to find those free transportation resources, as well as the free Lyft ride to vaccine appointment service, as well as the CDC vaccine information. With all these resources and information that you've heard today, I hope you learned yourself some vaccine facts, and that you can now go into your own community to promote vaccination efforts so that we can combat the COVID-19 pandemic in South Carolina. That's it. Does anyone have any questions?
No, ma'am.
Okay, sounds good. Well, thank y'all so much for joining today.